I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I do acne, I do scars, I do pigmentation, and I do a lot with facial balancing as well. We're going to talk about scars today. We're going to talk about how I was told before I ever got into this world, when I actually back in the day had a lot more scars on my own face, that scars were just something you had to live with. And it's just a permanent thing. There's just no hope. People would say over and over. And especially if you're somebody with a little bit more color in your skin, that's what people were telling you, that there's no solution. Rolling scars required subcision. We had to go inside there and actually break up that scar tissue. And she has so much scar tissue still inside there. So she did 11 sessions of laser. And yeah, that's not the solution. That was not the solution for her rolling scars. So even though it's like, it seemed hopeless because you may have done so many different things and you spent thousands and thousands of dollars, maybe it just wasn't the best approach. Maybe the person that was doing it just didn't know exactly what they're doing with it. Maybe, I don't know. Hi, Joey, how's it going? Hi, Martin, good seeing you on. You guys seem like good problem solvers over there. What do you think of silicone gel pads? I love silicone tape. I don't really know much about gel pads, though. I got to take a look and see what you mean by gel pads. Tape is excellent, though, for scars, especially the raised portion of scars. So hypertrophic scars, thicker aspects of scars. That's where silicone tape really, really works very, very well. Also, it helps even for like just shaping your face a bit. So it's really nice. It can help relax some wrinkles. I do it actually every night. So it's like I'm a big believer in it. I think it's a really good way of doing things in general for silicone tape. I had this patient actually do some silicone tape afterwards as well. I don't really believe too much in scar away or like creams per se. I don't really think that helps enough though. Hi, Alan. How's it going? Good seeing you on. How are you healing? Okay? Everything's recovering okay for you? Can you zoom in the photo for a second? Yes, I could. Let me try to get a little bit closer to, which photo? Are you talking about the after photo there? Let's see if I could get there a little bit more. I'll try to blow it up actually for you there. How's this? Better? I'll do it in both formats there so you can see. So what if everything has a solution, but the way people were doing it just wasn't right? What if that's the case? Like she did 11 sessions of laser. She did it with a bunch of, she did it with 2 dermatologists over in the Bay Area, and she had rolling scars. She had rolling scars, so it's like, how is that going to help it, really? You have to do other things. You have to do subcision. You may have to do filler. You may have to do something else, but like doing laser over and over and over again, Albert Einstein says, like, it's like one of the hallmarks of insanity is just doing the same thing over and over again and expecting a different result. It's like, man, you're doing the same thing over and over again. It's like, you probably at some point, maybe at like 1 or 2 times, you should start realizing that maybe this is not going to be the best approach. Maybe we should take a look and see about doing something different. Maybe there's something else that we should do instead of the same laser over and over again. Thank you so much, Alan. Alan said he left us a nice review on Google. Appreciate you, Alan. Really do. Thank you so much. And like I said, it looks like you're doing well. I appreciate that. Alan just did a second step of his laser treatments on Friday. So awesome. Let's see here. What do you think about microneedling with PRP for acne scars? Well, I don't think it's effective, really. I really don't. I think that the PRP could help a little bit with the healing process, but not going to really help with the scars per se. And microneedling, very, very mild improvement for it. Very, very mild. If it's like very, very mild scars, maybe it'll help somewhat. But most patients, this particular patient, he had done so many different treatments elsewhere and did like aggressive treatments actually elsewhere. And the only thing that really worked was proper subcision for him, as well as laser. And then also we did a little bit of Bellafill as well for him, TC across too. So all those things actually helped for this particular patient. Tony Santana saying, hi, Dr. Qazi, just wondering, is scarless healing possible? I think it currently is possible for some of the scars, like depending on the depth of the scar. Like one of my patients today, some of her ice pick scars are just completely gone. This is like her third step for TCA cross that I did today. And some of those are just completely gone. Some of the more medial scars are still there just a little bit, but it's some of them are kind of scarless. There are some medications that we're going to take a look to see if we could get scarless. It's possible. And there's some hope that I could. But it's still pretty early to be able to say if we have any opportunity to have devices or new drugs that would do it. It's possible though, and it's certainly something that I think is achievable for some patients, depending on the scar depth. Can IPL help post-acne scarring and ingrowns at the same time as a male? I think of the different devices, that's probably not going to be the best option for either of those issues. So scarring, unless you mean more for pigmentation issues, maybe it'll help a little bit with that. But in terms of hair removal, I don't think it's great. And sort of the scarring, it's not going to be good at all. Pigmentation may be a little bit helpful depending on your skin type. Lychee Peach is saying, do all rolling scars require subcision and filler? Well, not necessarily. No, sometimes it could just be a little bit of filler. Sometimes it could just be subcision, and sometimes it's both. It's not necessary that you do both of those. So you would recommend microneedling? Jess is asking about microneedling. No, I would not recommend microneedling. That would not help for a vast majority of these kind of scars that I deal with. So I do not recommend microneedling. I find over and over again that patients were told to do microneedling, patients were promised that microneedling will be effective for it, and it just wasn't really for these scars. And then they end up spending thousands of dollars. Like I said, this patient, he did several sessions before he came to me. And my patient today, she did 11 sessions of laser before she came to me. So it's it depends on what kind of scars we have to take a look at. Do I think Tretinoin would have similar results? No, not for this kind of scars. And this patient was on Tretinoin before. It's not going to help much for these kind of scars. It won't really do it. And Gok is saying, does Bellafill last 5 years or forever? I heard different things all the time. Well, the study was really 4 or 5 years, so that's what it showcases, and so that's why people say it's semi-permanent filler. But it's tough to be able to say that it's really gets absorbed completely by your body. It seems like that 20% continues to stay there in your system. And really, you have patients that you deal with for a long, long time, and they still have the Bellafill in their system. So it really goes to show that it really is probably more of the longest lasting filler that's out there. And I doubt that it really gets absorbed completely. And really that PMMA, I don't think gets absorbed. So it's pretty close to forever for the for patients for our purposes. I just started Tretinoin 0.025 after Accutane. I haven't had active breakouts, just ingrown hair. Well, good. That's awesome. But yeah, maybe consider doing a little bit of laser hair reduction. Maybe that'll help you out there. Between Flowers and Coffee saying, can you do CO2 laser on dark skinned people? Yes, I do it all the time. Well, if it's needed. Sometimes it's not needed, and we may have to do other treatments like TCA cross, or we do subcision. But if it's needed, yeah, we'll do it. Do you think volofilline actually works? It could help plump up the skin, but I think it's going to be a temporary effect. It's not going to be really something that's going to particularly help enough for these kind of scars. Currently, we don't have it available for us as well. So, we'll take a look and see if it's something that's worth bringing on when it gets available and approved. But right now, it's not actually. Tony Santana saying, do you recommend anywhere to do laser hair removal? I wanted to remove some on my face. Well, it depends on where you're located. I think there's a lot of places that do it. We do it for our patients. Laser hair removal is definitely not like the big thing, but we do it over at our practice, and we do it safely for darker skin types as well. Ruby saying, hi, Dr. Qazi. Great seeing you. Yes, great talking to you too, Ruby. Thanks for coming in. Thanks for coming on here too again. Appreciate you, by the way. And let's see here, and look forward to treating you, by the way, Ruby. Dice is saying, can I use an electric face brush between Accure treatments? I would not recommend it. I used to use that actually. I thought it was way too harsh for my face. I did not love it actually. I would not recommend. Are you talking about those Clarisonic ones I'm thinking, or something like that? I thought it was way too harsh, honestly. What brand of Tretinoin do you prescribe? I just do generic. It's just cheap. It's effective for people. You don't need a brand for that. And Lizzie's saying that they've been using La Roche-Posay adapalene and has been amazing. Yeah, it will help. Sometimes I do find adapalene could be a little bit drying for a lot of patients. So initially I have them do a little bit of a moisturizer for the first week, and then they could slowly taper that off as the weeks go by, and then just only use that by itself. And it works out really well. And what I was talking about with this is really just showcasing that for someone like this patient who's done multiple treatments before, and we finally were able to solve this. I got to kind of walk you through a bit for his emotional status here, because initially when we were working on it, first of all, when he came to me, he was really tired because like he had done things with really, people who tout that they're and market themselves as experts in scars, and they did like repeated treatments of things that just didn't help much, he said, over and over and over again. And then one person, a dermatologist, actually put him on a really strong peel as well, which ended up causing more pigmentation issues and redness. And he was really frustrated. He came to me already kind of in a frustrated mindset, and was looking to see if I could solve his scars. And I was looking at it, it's like, yeah, I could solve this though better. I mean, I could do this. So what we did with him is, people are asking how many different treatments. It's not the same treatment. So I did a few different things. I did Taylor Liberator subcision for the cheek area. I did TCA cross. And we did ablative CO2 laser in some of those edges of the scar. And then later on, we also placed a little bit of Bellafill for this patient as well. Incredible improvement for his pigmentation as well afterwards too. We wanted to make sure that was all evened out for him, because that was really important. But I'll tell you, really, for the first several months, he was just finding, I'm not so sure. Like, I do see it lifted up there, but because there was, first of all, a lot of volume loss, he had huge chunks of volume loss from there. And so even though I broke up the scar tissue and it popped up, he still saw the indentation. So I was like, let's put some volume in there. And then we did some volume, and then now he's happy. And now it's like a year later or so, where since I first met him, and he is super, super happy in life. And it's like, it's amazing to see. I don't know, sometimes he comes on actually over here. I know he's kind of silent sometimes, but if you're on, feel free to pop on and say hi. But he actually originally didn't let me share results and didn't let me show any of the procedure, but he was so happy with his results and so happy with the progress and the way he was treated with us that he let us share it, which I really appreciated, and just been telling everybody about it too. So it's really, really nice, actually, like, telling his friends everything and open about what he does now. But it was a journey. It was like he was at this point where he really felt that like he tried everything, and maybe there's a plateau, and maybe he just can't get to the best result and things like that. And I think he spent like $20,000 or $30,000, something like that, before he came to me. So it was already a huge investment. He said, it improved a little bit, but like definitely was not anywhere close to where he wanted. And he felt that there just wasn't as much attention to detail. He felt that like, when he would call the offices, they just weren't taking care of him as well. So really, it's like, that's why we focus so much on this stuff, because I could get it so that our team really could just be really, really responsive for everybody and making sure that we could arrange everything for everybody. And so, yeah, he did a lot before he came to me, a lot. And yeah, $20,000 probably worth of treatments. And that's, a lot of people say the same thing. And I always say to people that it's unfortunate. I wish that didn't happen to you. But I'm also dedicated to making sure this is the end of your journey. And this is the end of his journey, So it's like we'll do a little bit of fine tuning here and there, just a little bit more, just like a little bit more TCA cross, a little bit maybe more Bellafill here and there. But like we're pretty close. Like he's super satisfied with his skin at this point. Like he's just like, I think I don't really need to do much at all with this. It's like, this is what I was trying to achieve. I wanted so that I just wasn't feeling as sensitive when I was taking photos, or I was outside with friends or at clubs, things like that. He's someone who has a great social life, and it's like just felt self-conscious about it. And whether it's from scars or my patients today, I actually have so many patients today for melasma. And the story, like universally for my melasma patients, is the same. Actually, is that really there's a lot of discomfort with the fact that they have the sudden patch of pigmentation that's really difficult to cover up and really tough for other people to ignore. Sometimes there's just unfortunate comments that people make. And sometimes it's maybe even more than people with scars, honestly, people with hyperpigmentation. People maybe comment a lot more. They may even not necessarily be doing it in a mean place. Sometimes people assume that there's like liver conditions or other things, and they get concerned with that. But it's none of those things, and it's like it puts more stress on patients, and it's difficult. It's really, really tough. So almost, so many of my patients say they all have that story there that like their melasma just was affecting their quality of life, and it's kind of really worth thinking about, like just how so many different conditions do affect your quality of life. It's like so many things do, and it's like sort of like in the background, and this noise in the background. And then sometimes when there's more stress and other things that are factoring into your life, and now suddenly everything just shoots up and like all the stress comes out, and that's really tough for you. And it's really, really tough, and it's like, okay, well, let's try to control each of these things one by one so that you could get your threshold back down, and hopefully your stress is more managed. Because one thing I noticed really in this world now is just there's so much anxiety, so much stress, so much of that anger. A lot of anger, and like it's all really tied together with this. And sometimes it's like just there in the background, and then like something else just tips it over the edge, and now everything just gets really bad. So it's something that I think is solvable. Every single thing I think of those problems could be solved. It may not be exactly the solution that you think. Like this patient was thought that he was going to experts and thought that he was going to people and thought that things weren't solvable, but it was solvable. And it's like this patient today that did 11 sessions of laser. She did Fraxel laser, I think halo laser, also a few other things. And it's like 11 sessions. And honestly, it's like, I'll tell you really, just really like this is something you should be paying attention to, that if you're doing the same thing over and over and over again, just like kind of look at it and think that like, why is it that they're just doing the same thing over and over again? Why is that? Why are they only throwing a laser at this problem? Why are they just keep on doing that over and over and over again? Is that like the only tool in their toolbox? Maybe they should expand it, or maybe they should really be telling their patients that this is not their specialty and they should go to someone else. And I would say honestly, fortunately in our area in Orange County, a lot of the dermatologists in our area and plastic surgeons actually send patients to me because they know that this is not their world, this is not their expertise, and I'll be able to handle it in a safe, effective way for them. But there's unfortunately a lot of people that are like, in other parts of the country, the Bay Area, like my patient today who did 11 sessions of the Fraxel laser was in the Bay Area. Other people a lot of times are from Arizona, Nevada, or like just all over the country. And someone got them kind of hooked on a package. You'll hear it a lot of times. It's like, actually, when my consultation, they'll tell me that, I wish I discovered you before because I just bought this package of microneedling sessions of like 6 sessions of microneedling. So now what am I supposed to do? I'm like, I don't know, like maybe try to switch it over to like Botox with them or something. I don't know. Botox is always okay. Tichana is saying, hi doc, I have another consultation with you next week for my back, but can I, not for my back. I have another consultation with you next week, but can we also go over the plan for my face acne scars? I scheduled acne scar treatment with you in January. Awesome. Yeah, Tichin. And hopefully baby's okay. I think you probably had your baby by now. Hopefully baby's doing well. So I look forward to seeing you. I know I missed a few questions here. What's the cost estimate? So most patients spend about $5,000 to $7,000 on their scars. It depends on how much volume loss there is. This particular patient probably spent a little bit more because of the amount of volume loss that he had. So if there's more volume loss, we may have to do more products like Bellafill or Sculptra, fat transfer, things like that, and that's going to be additional there. Let's see here where it was. User Chawad is saying, if I pay for a consult now, can I use it next summer when I'm back in the country? Yes, you could. Yeah, you could do that, mate. User 31 saying, microneedling is the worst, 0 results. Thank you. Yeah, that's exactly what I would say. That's exactly what I would say. I mean, some people may help a little bit, but like it's a big waste of money for a lot of people. It's unfortunate. And like these kind of scars, big waste of money. Looks great. Any recommendations for him if he wants to work on the texture even further? Yeah, I'll do a little bit more TCA cross, a little bit more Bellafill, and probably I would have liked to do like a low energy laser, like a erbium laser for him. Do we do virtual consultations? Yeah, absolutely we do. We do it all day long, virtual consultations. We have most of our patients are from out of state, so most of our consults actually are virtual. Mel saying, and by the way, you could do it just through my page directly. Our prices are on our page. You could just go directly on our page. You can see most of our prices. And remember, most patients spend between $5,000 to $7,000 on their scars. So you can see our price list on there. You can see pretty much everything on there. So it's, except for some certain surgeries, but like pretty much everything else is on there. And just go to drqazi.com and it has like everything. JML saying Sculptra or facelift at 42. It depends on what's happening. Like I'm 42 years old. But like I because I was doing collagen fillers, I found that my skin quality is much better. So if it's like you lost a lot of weight, if you like there's a lot of laxity, then yeah, maybe you have to do a facelift. But if it's otherwise like it's tight and it's okay, then maybe just a little bit of collagen fillers. Maybe it's okay. What procedure do you need for these scars? Just joint? So yeah, perfect. So these are rolling scars mostly, and a little bit of boxcar scars, a tiny little bit of ice pick scars as well. So we did subcision for this patient. We did ablative CO2 laser in some of those scar edges there. We did TCA cross, and then we subsequently did some Bellafill as well. Are there any other collagen fillers other than Bellafill? Well, Bellafill is the only FDA-approved filler for scars, but you could do other things that stimulate collagen, such as Radiesse or Sculptra. You could do, if you want, you could do hyaluronic acid filler too. That's fine. But usually I prefer something that's going to improve scars, and that's typically something that we would call like more like the biostimulatory products. Is 31 too old to get similar acne scars fixed? Absolutely not. No. I mean, some of my patients are in their 70s. No, it's absolutely not. You could definitely get beautiful results no matter what age you are. Sometimes it may just take a little bit longer, but you could do that. Have you ever had any issues with letters to HSA, FSA, and them rejecting claims for use of funds for acne scars? It's tough to, that's going to be case by case for the patients. I'm happy to help out where I could, just like within the bounds that I could. But I've seen some patients that I got accepted from before, but I don't know if they've had people that rejected. I'll have to ask the team. I'm not sure, to be honest with you. It's not like a super common request, but I believe the FSA sometimes does cover it though. So it's just up to you and see what potentially what level of coverage you could get, and maybe they'll do it for you. If they don't, I think that most of the stuff should be covered by insurance. Really, I mean, scars are really a pathology of the skin. If you look at this, it really is very clear that it's a pathology of the skin. It causes other consequences like loose skin. It causes just premature aging. It causes sometimes for some people depression, anxiety, and that sounds a lot like a medical condition to me. It sounds like something that should be really covered by insurance. It's unfortunately not. I think it should be really in that same category of really more reconstructive work, and not like it's just a cosmetic by choice type of thing for a lot of people. And it's not like, what do you expect people to do? Just be living with something that's bringing them down like that and so distressing. And from something that happened when they're 16 years old, imagine that. Just imagine someone 16 years old had some breakouts and then it ends up like scarring them forever. And then they're told that there's no solution for it. So many people are told that there's no solution. There's nothing you can do for scars. Everyone says there's nothing you can do for melasma. There's nothing you can do for scars. If you're darker skin type, especially, it's just like you're just out of luck. And it's like not true, and I wish they just would stop saying those things. I wish they would just kind of just like realize that maybe they're just not the expert in that world. And maybe there is a way to do it. It's just, they don't know it, it's possible. I think so. I think that they just don't. A lot of times it's like a matter of doing the right treatments for the particular issue. And maybe the way they were taught wasn't the right way. User 31 saying, I'm coming in next year. Can I do my yearly TCA peel at the same time as scar treatment? Maybe not the same time. I'd probably wait several weeks or months, depending on how deep the TCA is and the concentration of it. I'm not sure. Jen Love is saying, I noticed a lot of sagging with acne scars. Is there a specific treatment you lean towards for this issue? Yeah, you could do hyperdilute Radiesse could actually help more for laxity. And if you need to, you could actually do things for skin tightening, like either Morpheus 8, radiofrequency, and microneedling, or even if it's really a lot of laxity, you may have to do a facelift. That could be another option. What are your thoughts on exosomes? I don't really have much of an opinion on it. I just know that the FDA wrote a letter about it and was against it. And I could say that when these guys have presented material to me, it just never was anything too impressive. That's how I viewed it. I never really was wowed by anything, which is why I've steered away from a lot of that stuff. So I'm open to it. Maybe at some point it'll be okay. Maybe there'll be like something that's like really, really nice. But I'm pretty skeptical at this point because it's been around since I've been practicing, and it's like, 9 years or so of people talking about this. I don't know. I haven't heard anything that's like been amazing. Nobody's been wowed by it, about stem cells and then now exosomes. All this stuff is just, I don't know. It doesn't seem like it's that impressive to me. I know what's weird. I'll just say, just as an aside, that like a lot of the people that seem to kind of really push it just tend to be like more shady people, to be honest with you. I'm sorry to say, but like, sorry. But like, this has been my experience. I haven't been to conferences in a long time, so maybe it's changed. But like when I would kind of go to these conferences like years and years and years ago, I just found that like it was just really sketchy type of people, like the snake oil type people that were like pushing exosomes, or like they would like literally push like any of like the latest type of thing, and like they would become what they call KOLs, or key opinion leaders, for these products. And it's kind of odd, it's a little bit strange that they would do it that way, but they would just like flip. They would go from like one thing, it'll be like one time it'll be like a PRP thing, then it'll be like exosome thing, and then it'll be like a stem cell thing, who knows. And you talk to them, sometimes they have like crazy ideas of like stem cells like curing this and stem cells curing that, but like, dude, like why don't you like publish this stuff, or like this sounds like it could be like really impressive for a lot of problems. And then it's just like silence, radio silence, in terms of, like there's some like, I don't know. I don't even know what it is, but like for 9 years, you couldn't get things published, or any, like your corporation couldn't do that. It's like, man, how much, like you're spending a lot of money on these products. It's not like they're like small, these are multi-million-dollar corporations, and they can't come up with good enough studies for this. They can't show great enough results for this stuff. So I don't know. Big D saying, did you post this on YouTube? No, I haven't, because he actually didn't let us share his progress until afterwards. He was happy with the result, super happy with the result. Then he was like, you know what, I want to let everyone know. And so that was really nice. And yeah, VD, I keep on forgetting to text you. At some point, I'll message you back. I know you sent that message earlier, but I have gone over it multiple times on here though. But I'll be happy to help you though at some point though. If you, I'll circle back with you. User 36 saying, I bought Bellafill and have an appointment tomorrow for Accure. Can you free some time for filler for me, please? I don't know. I can't promise. I kind of sometimes promise stuff like that, and then the team says that I have like people were backed up. So I got to be super fair to all the patients that have appointments. And like I don't want to run too late for anybody. I'll be happy to try to help you if I could do it. I'll do it. But I also I can't just like say that I could do something and like do a treatment without running it by them first, though, because I don't want to push back the whole schedule. Sometimes I'm like, oh yeah, sure, we could do it, and then it's like potentially there was someone else I didn't realize was waiting for me, or it came a few minutes late. I didn't realize now they're there, and like I probably should go see them. So I definitely could. We'll try. If I can do it, I'll do it. And it's like absolutely. How was my day so far? It was actually awesome. I did some really cool cases today. Actually, a bunch of consultations and a lot of follow-ups. So it was really cool. Honestly, that's what's. I hopefully all of you guys find something that you enjoy in life, and like you do. And it's like really, even if you had a lot of money in the world, you would still do it. I hope so. I hope you guys find that. It'll be really cool one day if everybody finds that. Like just things that like, and you feel better about, and you're helping other people about, like that'll be really cool for everybody. I hope so. I hope everybody gets that enjoyment in life, because it's like really worthwhile. One time I was watching like this UFC fighter, and like he was like hoping that on the world. I was like, this guy looks awesome. This guy is really, really cool, because he said that. He's just like, they were like, how do you feel right now? He won like he won this match, and he's just like, I just want everybody in the world to feel what I feel. I just want everybody to win at something. That's a really cool thing, actually. I was like, that's really nice. That's a really perfect statement, actually. And I was shocked that like nobody ever really says that normally. Like you never really hear people like post fight or winning something saying like, I just want everybody to feel what I feel. That's like, I was like, that's actually awesome. And those are things that like you kind of I hope for. I want everybody to feel that same way too. Like what I'm doing like this is like, I hope so. My husband is loving your services, doctor, by the way. Awesome kittens for you. Thank you so much for telling me that. How do you decide between Sculptra versus Radiesse on the first comprehensive scar treatment session? Well, it depends on how loose the skin is. It depends on what we're looking at with that. If there's laxity, then more likely I'll do more of like dilute Radiesse. If there's more volume loss, then potentially more Sculptra. If I'm trying to really support scars and keep some sort of support there for the scar, then I do more like Bellafill. So that's my mindset really for things. So I would say probably don't worry too much about it, but I will tell you exactly what needs to be done for your particular scars. And that's what I was talking about yesterday, is that I am not bound to any company. So I choose depending on the patient. And it doesn't matter to me whatsoever, if the company wants to give me lock me up with a whole bunch of other products from the thing. I'll just stick with just the products I like, and I'll get some other products from a different company that I like, and I'll just mix it up however I want to mix it up. And I like that. It's really, really fun for me, because then I get to choose the exact best thing for that patient. And that's why anyone who walks around my office knows that I have different laser brands, I have different everything. So it's like I'm not stuck with anything. That's awesome. That's really cool for me, because I like the fact that it's just I could just tailor exactly what the patient is. Big D saying, yes, I love that, man. Happiness over money any day. Yeah, I mean, I hope everybody has enough money in life that they could just be happy, really. I think that money is just the biggest problem, that we just live in a post-money world where everybody has universal basic income and you could just do what you want to do. I think that'd be amazing if we could do that. If we could achieve that, I really do think all of us will be able to come up with a solution to every problem. Probably any of us can manage the healthcare system that is in this world today better than what is happening right now. It's just like a disaster. And if we could take away some of this profit motive and all that stuff, it could end up being something really, really amazing. So it's just I hope all of us could just have a universal basic income. And then so many of my patients are I ask them, what do they want to do? And so many of them is I wish I could just do art. It doesn't pay. I wish I could do this. I wish I could build something. I wish I could design things. I wish I could do this. And it's man, how many people are missing out in this world that could just be inventing stuff or creating things for us and things that we could all love and enjoy. And because they're stuck doing, a job that they don't like doing and things like that, they're not capable of doing it. They're not able to do it, or it doesn't enhance their abilities and stretch their mind a bit. And hopefully I could always do that for people. I try to do that for my team. I always try to see to get them better and better and better. So every year there's amazing growth. That's really cool to see, actually. Really cool. It's amazing. You see where they were last year, you see where they are today, and you could envision where they're going to be in next year. It's pretty cool. I think it's imagine now being able to do that for so many things. My son has acne on his scalp. He had Accutane, didn't work. Any recommendations? Well, it depends on what dose of the Accutane. That really should have helped it. Or was it truly acne, or was it more scarring? There's a few things that we have to question with that. Hi G, how's it going? By the way, hope you're on. You heard some of that from earlier. Max is saying, missed earlier part of the live. What type of scars and what treatments did you do? How long after? So these were with rolling scars. I did TC across. I did subcision for this patient. In this photo, this is about 6.5 months later afterwards. I've seen him actually since this time, though. He was just coming in just for some quick, for some filler. And then we also did some Dysport for him as well for some wrinkles. So I've seen him a couple of times after this, but this is about 6 months after. Are there any over-the-counter methods to treat ice pick scarring? Ice pick scars, probably not so much. You may reduce the diameter a bit by reducing oil production with something like tretinoin, like some sort of retinoid, but it's not going to really change otherwise, though. Does laser fix this? Good question. It'll help. I did ablative CO2 laser for the edges of the scar. That's what helped get it a lot smoother. He did have a little bit of underlying melasma around his eyes, so we had to be pretty careful with overheating his skin and things. So it was very focused with the energy that we were doing in areas that he didn't have melasma. And that's why I do a thorough assessment beforehand. I go through a lot of photos to check where that melasma may potentially be or hyperpigmentation before I do these treatments. What is the most memorable patient story as it relates to their experience having acne scars? Actually, I don't know. He actually may not be coming on as much anymore. He used to come on all the time, but he's been super happy with his skin. There was a patient from Minnesota, actually. The first time I met him, he was telling me how he was next to a woman on the plane, and she was really beautiful. And, he was just he was telling me in all seriousness that he just couldn't talk to her, though, because he just felt so self-conscious of his scars. And he was saying that was on the flight to me. And then I saw him a few months afterwards, And like he came to me back from Minnesota for step 2. And now he's like beaming. He's super happy, super excited. And he's just like, I met this girl in my class. I finally got the courage to talk to her. And let me tell you, it was like one of the most amazing stories you'll ever hear. Like it was amazing. He says there was the Northern Lights that were going on. So he's in Minnesota, right? So he's like the Northern Lights are there. And I was like, you want to see the Northern Lights? And actually, when you think about it, that's actually like an amazing pickup line, actually. Do you want to see the Northern Lights? Like, let's go see the Northern Lights. So he says, let's go see the Northern Lights. And so she's like in the car, I guess she like agrees. And she's like, oh, we can't go, Ash. It's going to be so cool. He's like, no, I got you. I got like, look at the back. I got so many blankets. And she's like, oh, but like, we're going to be like, okay, that's awesome. That's like amazing. But like, should we get some food? She's like, no, we're going to go there. We're going to eat. I already packed a bunch of food. It's like an amazing story. And then he's like dating this girl. He's like super happy and he's like excited. He came on like a couple months ago, just talking about how amazing and happy he was and stuff. That's an amazing story, right? Like the initial journey is that he comes to me and he can't even talk to the person next to him because he's so self-conscious of his scars. And then he had like the confidence to ask a girl in his class that he actually liked from the beginning to go to the Northern Lights. Honestly, also, by the way, like how cool is that pickup line though, right? Like, do you want to go like the Northern Lights? I would love to see the Northern Lights. Pretty good. How do you determine what percentage of TCA cross to use for scars? It depends on the depth. I could do like anywhere from 35 to like close to 100% sometimes. Depends on the depth. Yeah, go Minnesota, right? Like I don't know. I would love to see the Northern Lights sometime. And it was like that. The last year it was like awesome. I think supposedly I think last year was. Alam is saying, what is this treatment called and how many sessions do we need to see results? Since G is on, we're going to call it the combo with the Q. No, but there's no real name for it. It's just a combination session here. Will Accure cause dryness? It's actually none of our patients have said it's dry. Actually, it's not dry for them. It's just more normalized. What do I do for my skin? I do lasers. I'm due for my laser. I'm going to try to do it this week, but I do lasers. But I appreciate you saying it looks flawless and glowy. They say thank you. Lasers are really the main thing, honestly. Do you do buccal fat removal? My partner does actually. She does a great job. She only takes a deep pocket of fat, leaves the superficial fat there. She only just takes that part there. And let's see here. I know I missed a few things. Oh, and what other treatments have I done? Well, I've done a lot of Bellafill. I've done Bellafill. I've done filler overall. It's worked incredibly well for honestly. I think it's been awesome. Bellafill that's why I like it. It's on my own face. It's like I think over time it got better and better, and it's really fun to see that. I missed a few things here. How often do I repeat microneedling to effectively see results? Unfortunately, may not see much results with microneedling. So maybe consider doing more of these treatments for something like microneedling. How long do you have to be on spironolactone? Is it safe to be on long term? So maybe until after menopause potentially. The thing is that spironolactone, which is a medication that we've had for a long, long time, we've known about it actually because it's cardioprotective. It's for patients with heart failure actually originally. And we know that it reduces sodium in the system. So it basically pushes out sodium, you pee out your salt. And that's good, especially for heart patients. But also it has an effect where it could help block the byproduct of testosterone, DHT. So really useful. So for scars, for acne, because it'll control the oil production. That DHT could actually trigger an oil response in your body. It could cause the sebaceous glands to produce too much oil. So really, really effective actually especially for women. And the reason why I say for women is because in men, it could sometimes enlarge breasts. So it could cause gynecomastia. But otherwise, it's actually very, very minimal side effects for the vast majority of patients. If your blood pressure is normal, if you're not on other medications that are going to keep potassium in your system, which is really, really a very few things. You're not going on like a binge for like bananas. Believe it or not, there are some people that just like are obsessed with bananas and just eat a ton of bananas. So you do have to double check sometimes. But other than that, like it's really, really good. It's a really good medication for patients. So like, why not? I would say spironolactone is great. User 36ing, I hope you can inject me tomorrow, doctor, so I can look good for Christmas. They told me I will not have any availability till February. Okay, yeah, I hope so. I know I'm super packed, but I will try. Trust me, I will try. If I could do it and it's not a burden and I don't rush myself, I never rush myself with any patient, so I always want to make sure it's dedicated time. And if I could do that for you, I will do it then. So those are the things. But maybe someone comes late sometimes. Like that ends up happening. I did a patient today because another patient was running a little late, and I knew that wasn't that I could be able to handle that and do it for her, and it looked awesome. So yeah, it absolutely could be done. What do you think of Radiesse instead of Bellafill? It could be a great option if you want to do Radiesse. Totally fine. It may not last as long, may not give you too much volume, but it does work in terms of skin tightening too. So it's a calcium-based product, really, really great product. I love it. I've been using it for years and years, probably like 7 years now too. Actually almost 8 years now. Wow, time flew. Wow, that's pretty crazy actually. I didn't realize that things really are flying by actually in life. What is the length of time to see results? At least 6 to 9 months, at least, honestly. And that's not like final results. Like the patient yesterday was telling me that she found that her scars got better 1 year later. So, and that's the same thing last week. It's like over and over again. Daisy Mancino saying, I've done so many treatments for scars and I feel like they just won't go away. I need to come see you. Appreciate you, Daisy. This patient did too. Like he was really frustrated at this point. He was really frustrated. He was like, and he came to me frustrated. He's like, I did so many things and he spent so much money. He said, maybe, I think it was like $20,000 to $30,000 he spent. So it's tough, honestly. I was pretty upset because I spent $3,000 and like my time, it felt like a ton of money. It's, I'm not sure what 3,000 is equal to now, but like it's certainly not $20,000. My thought was a lot of money. It was like my own money. It was just like out of my own pocket, and it just sucked. So it's like, and he spent like 20 something thousand. There's a lot of patients that would spend like $20,000 to $30,000 before coming to me. $40,000 sometimes actually. Canola is saying, if a patient were to travel to see you for acne scar treatment, how long would they expect to stay and how often would they need to return? They don't actually have to stay in town for particularly long. You actually could just leave even the next day if depending on what we're doing. But depending on how many times, it's really for the depth of the scars, what we're trying to treat, how much volume loss we could do, all those things. Can TCA Cross potentially deepen acne scars? Yeah, potentially it could, but it's really unlikely if we're doing it properly. I try to just be able to do just like some focal spots right there, and then I don't do the same concentration on each scar. Yeah, we're booked up until February. I did tell them to try to get, because a lot of patients were messaging in to try to get some Botox in before Christmas time. We're going to see, we're trying to let people come in for that right now, but it's tough, try to book things way ahead of time. It fills in really quickly. So try to do it because I'd be happy to help you. And I don't ever want to rush any patient or anything like that. I just never do that. I don't believe in that at all. So it's like you guys spend a lot of money to work, to do things with me. You also took a lot of time out of your day just for work or with your kids, anything else. Patients for scars, most of our patients travel from out of state. So it's like, I will make sure that we're going to get through an excellent result here. It's like, really, my team knows this. My friends know this. My family knows this. I really do just have this willpower where I'll just just continue to do things properly until I could get things done for people. And it's really important for me just to be able to get that, because it's sometimes it's just a matter of just pushing through it and making sure that you're not being lazy and just double check. It's sometimes you do feel maybe it's good enough. And then you go through, I'm like, you know what? I don't know. Let me go double check again. So then I check again, and it is actually a little bit there is still a little bit of scar tissue there. Or sometimes I'm doing filler. I'm like, this looks pretty even. I think there was a little bit, but then I'm like, maybe let's fix this a little bit. Let's go through and see if we could do this even better. Or let's just double check, triple check in each angle, and let's just do it and let's double check. And it's worth it. I like that. I like the fact that I will just keep on pushing and keep on doing it. Because it's there's a solution. There really is. And it's sometimes it's just about effort. Sometimes it's about talent, but a lot of it's just effort, honestly. I would say most things in life are just effort. Most people can achieve things. It's just that a lot of people are just lazy. That's about it. They just don't love what they're doing or whatever else. I don't know. They just don't care. I don't know. There's something I saw before that a lot of times in this system that we currently have, it rewards people that have antisocial or potentially even sociopathic tendencies. You get rewarded, and normally in normal societies they get ostracized, right? But people who like are like tricky or like trick other people, things like that, they get rewarded. And it's like really unfortunate then, right? Like that's the world, that's the way the world's set up. It's like other people think if I don't do it, someone else is going to do it. And it just keeps on becoming a cycle over and over and over again, like forever. And it's like, man, maybe if like someone sat down and like came up with a proper solution instead of like trying to just trick someone because they think other people are tricking people anyways, yeah, you know, maybe the world would be a better place. So that's what I looked at it. I was looking at this like, this is a problem that like so many people, I did Fraxel, I did microneedling, I did so many things. And then so many people said that it's just like, it's in my head. It's not that bad, blah, 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 blah. Nobody else could see it, blah, 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 blah. And then it's like, you know, I was okay with like some scarring. It's okay. Like, I'm not like, didn't expect perfection, but like, I did think that there just should be a better way, if that makes sense. Like, it wasn't like so much that like, you know, okay, this is, I really just want glass skin. I never really like was like pushing for that. I knew that it's probably not going to be possible to just get completely glass skin. So I was like, okay, that's okay. But like, certainly like doing these 6 Fraxel lasers in microneedling sessions, there's gotta be something better than that. Like, there's just gotta be. And like, maybe like people just aren't doing it right. What if that's like, it's crazy. It turns out that's true. It turns out like that's the case. It's like, what the heck? Why is it that nobody told us that? Like, why was it that everybody was pretending like this is the best possible solution you could have and there's nothing else you could do? And it only takes like certain people in the world that are capable of doing it. And actually, it's like maybe those other people should have done it. They should have been able to do it. They had the tools, but maybe they just didn't have the willpower, you know? And that's what it was. That's all it was lacking there. Maybe it was just a matter of just like they weren't focused enough. When they're doing it, they weren't hyper-focused. Some of it's skill, you know, I definitely say I've seen some people like sometimes it's skill, but like a lot of it is actually just like focus. I'm like just like doing it and doing it really, really well. And like just like making sure that you can do a really excellent result. It's entirely your responsibility to do it. And you're going to do it from start to finish. It's on you. That's pretty cool, actually. It's a good feeling that you do it and you put that effort into it every single day. Pretty cool, right? I think it looks like a lot of people agree. Love your perspective, effort, yes. Thinking outside the box, yes, definitely. And honestly, there really shouldn't really be like this box. A lot of stuff that's put, that they act like there's this box. They act as if there's like so much science behind it. They act like there's so much studies behind it. They say that this is like what this is what it is, blah, 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 blah. It turns out that like it's really flimsy. It turns out that like a lot of stuff is like a lot flimsier than you actually expected. And it's like some dude from like the 1930s like did some random study and it's like really, and like that's what you're basing like everything on. And was it really like this urgency to like continue it? Because it's like, I don't know, this sounds a little bit strange. Like the fact that like 200,000 people in America currently have a higher than normal level of fluoride, it's like kind of odd. And like they discover that fluoride does have a link with like high concentration of fluoride does have a link with like aggression and with mental retardation, things like that. And we're just kind of cool with the fact that like there's 200,000 Americans with higher than normal fluoride in this country. I don't know. It's a little bit strange. It's like, was it really worth it? Or could there have been other ways to like fix the teeth issue, whatever you were concerned about without putting that in water? I don't know. It's like, I was always like kind of like fine with it. I was always like, just trust the science. And I was looking at it, it's like, why is it though? Like, why do they do that? Like, why is that the case? It reminded me like when I was with and I was with my wife one time and we went to a restaurant and we actually got like this grapefruit juice. I was like, really like this is really nice. And she was actually pregnant at the time too. She was like, we got this like really nice grapefruit juice. And it was like, they put it in like this champagne bottle and they like put like this tiniest amount in there. And I was like, can we just put this a little bit more? And they're like, you know, it's like tradition. And I'm thinking to myself, like, I don't know, like, where did this tradition come from? Like, why are we like insisting that you just have to have this little amount in the glass? Like, why does that look better than like filling it up? To me, it'll be nicer, I think, aesthetically, if things are more full. I get a little nervous with the fact that there's like very little in someone's glass. I'm like, the guy's going to order again really soon. Like, you just gave him very little amount and he's going to order again in just a few minutes. So like maybe just put a little bit more, but like the tradition is that you have to do just a little amount on the bottom. I don't know where that came from. I don't know. Why is there that box? I don't know. Why are there's these random rules like that sometimes? I don't know. Sometimes you just have to wonder, like, who came up with these rules? Who says that? I'm not sure. It's like, you got to kind of wonder about like all that stuff. So when someone told me, like someone on here saying they were told that like TCA cross does this or that, and so many other places don't do TCA cross, why is that? It's because they were told it doesn't work. They were told that like, don't do it. They're told it does this, or told it does that. And it was like the same thing over and over again. Some supposed expert was saying over and over and over again. And everybody's just quoting that same one expert. So nobody's like doing some investigation themselves or like just like repeating the same thing someone said 20 years ago. Kind of interesting, right? Like that's the same thing. The same myth basically is just sent a generation after generation. That's how you transmit myths. What was done here, this was, hi Miriam, by the way, this is with TCA cross. This is with the ablative CO2 laser at the edges. He had a little bit of melasma, so we had to go really focus on some of those areas. We did some Bellafill for the patient afterwards. We did, I think I did say subcision too, right? Can you come to Dubai? I don't know. It's up to the up in the air right now. I don't know. I'll just say, as an aside, I think it's cool what they're doing with the country of Dubai. There's some things that like, I don't know, that I have questions about what they're involved with though, internationally though. I don't know. So we'll see. At some point, maybe I'll go there though. I think it's like, it's got cool energy is what everybody says. I definitely like would like to go to some place like that at some point one day, just to kind of set up things. But like, I don't know, some things kind of bother me with a lot of stuff though. So we'll see. I think more people should just like be asking questions and like try to change things instead of just accepting everything. That's how I think it. Usma saying, can you recommend any doctor in the Miami area? I get a lot of patients from Miami actually. My patient yesterday was calling me from, not Fort Lauderdale, what's the other one that's there? I guess it's, Orlando. He's actually Orlando because I now remember because he had a big Penny Hardaway thing. Actually, no, it's a Shaquille O'Neal one. He had a Shaquille O'Neal jersey in his room there. So the Shaq and Penny group were actually one of my favorite groups actually out there. I used to always do those guys in NBA Jam. I don't know if anybody ever did NBA Jam, but those were like my duo that I just used to dominate. Is there any scar treatment you could do on Accutane? You could do a lot of them. It just depends on the dose. I'm not sure how high of dose you are for Accutane. Really matters. I'm not sure. But if you're on like a lower dose, yeah, you could do it. In fact, actually, sometimes it helps because you normalize the oil production. As long as you didn't go too dry, you can actually get a really, really nice result then if you normalize it. Some people do not believe in themselves. User 36 is saying absolutely that's the case. And some people just don't care. They just don't care what their work is. They don't care about like what the outcome of their bad work is, things like that. And it's really unfortunate. I don't know. I hope everybody could just achieve greatness. That's it. I said it before, really, I do. I don't want anything to hold people back. I don't want scars to hold them back. I don't want their, pigmentation to hold people back. I don't want people feeling like their facial imbalance is holding them back in life. I don't want anything to hold people back. And like the things I can control in this little world, but there's other things out there that like you could maybe be involved in. Maybe you could help people out like that. And so then nothing can hold people back because in your mind when you were like maybe younger that maybe it was really bad. Maybe like the world was terrible for you. And it's like, maybe it would have been nice if somebody like did show you and teach you that like nothing should hold you back. Maybe that'd be really cool. Do you advise against at-home derma stamping? No, it's fine. You can do the at-home derma stamping. I just don't think it's going to help too much for things, but you can do it. It can may stimulate a little bit of collagen. What would you do for large pores? The easiest thing to do is just do a topical retinoid. That's probably the easiest thing to do. So, or just pick up a different gel. Someone was talking about adapalene earlier. Just pick up different. That actually works out really, really well in general for like oil production. And then sometimes that will reduce the pores. You can also try niacinamide. That's another option, but different and works out pretty well. What laser is best for PIE and darker skin tones especially? I think the XLV works incredibly well. V-beam is good too, but sometimes you could get a little bit more rebound pigmentation, especially in patients of Asian descent or just patients who are Hispanic or darker. So sometimes V-beam could be okay, but it may be also at risk for more pigmentation issues. Does Botox help smooth skin? Yeah, you can even do it with microchanneling. You can microchannel botulinum toxin in there, and that actually helps also with smoothing skin. And actually, just above there about the pores, it'll help with pores as well. What do I think of derma rollers? Don't love those actually at all. Don't really like those at all. I don't like anything rolling. Microneedling, good. You could try it. Honestly, give it a shot. It's not going to help too much with these kind of scars too. It's not. Sorry. It's like really, it's not going to be as effective as people think. And I waste a lot of money on it. A lot of people, most of my patients have wasted stuff on it before. They tried it before. It's like for these scars, just not going to work. It's not worth it for you. So I would just rather you just try to do something that's going to actually help you. Let's see here. Is retin-A still needed after finishing up Accure laser package? Yes, you still want to be on some sort of topical retinoid. So they're saying, what about Accure for pores? It does help with pores. By reducing oil, it does help, but it's not like the thing I would be shooting for. You have to have a lot of oil production for us to justify that. Emily Hardesty saying, how do you decide if someone is a good candidate for TCA cross? So TCA, the way it works is basically it's an acid that we're placing at the base of the scars. It's breaking down the protein of the skin. So sometimes you see a little bit of a white coloration there. And then sometimes what we could also do is the inside walls of the scar, we could get a little bit of scar contraction. What we want to see with the patients is just to see the depth of the scars, see what kind of scars. I actually do TCA cross even on rolling scars. I do it in boxcar scars, do it in ice pick scars. But really, like for a lot of patients, boxcar and ice pick scars would work very, very well. Just you want to change the concentration of that. How long is the waiting time to see you in office for an initial consultation? I believe it's in February or March, I think is what they were saying. I know someone saying here in February, but I'm not sure if it's still available in February. But just go book it on our page. Just go to drqazi.com and they'll schedule it for you the next day. So they'll try to set it up for you. So just book it on my page, actually, just Dr. Qazi. And you never know. There's some people that need to change their appointments, things like that. So then you get bumped up on the list and do that. Thoughts on plated? It seems okay. There's some patients that actually liked it. Some people liked it. But I don't really use it, though, to be honest with you. At some point, maybe I'll try it more as I get more feedback from patients. Can you use TCA on wider chickenpox scars? Yes, we could. Yes. Do it in the inside walls, and we could get a little bit of scar contraction. And yes, we accept all forms of financing, really, pretty much everything. Right now, like people choose anything, but Chewy is really popular. Chewy, like a lot of people are. Please be open-minded about opening up a clinic in Dubai. I gotta also, I mean, besides the other stuff I was talking about, I gotta also make sure that everything can be done just at a really, really high level. And I know that there's a lot of these clinics over there. Sometimes I don't know, like it feels almost like they may be just more like driven for like influencer culture and potentially, like that whole world, like influencer type world, which is like definitely not my world at all. Definitely not the thing I try to push at all. So it's kind of, I don't know, I'll take a look. I'm open to it. I have a lot of patients that want me to go there, and some physicians who have asked me to take a look and see about that as well, because they would be interested also with that. So it's something I'm looking at, but like, I got to also make sure it's not like that influencer world. I don't like that world. That's why I'm not in Beverly Hills, I like, I just, honestly, I'm not. And I picked my area because it's just like 5 minutes away from the airport. Really, that's why I picked it. I just wanted something super convenient for people that like people could fly in and fly out. But like, I really just like being like for the people. Like honestly, it's really like I don't like that whole world. I really don't. I just don't like it. Like people sometimes ask me who my favorite celebrity is, all that stuff. I don't know. I don't know. I don't really pay attention to any of that stuff. I just like doing my work, enjoying my life, being with my family, my kids, and like I don't really care about like this influencer life and all that stuff. So I don't know. Mount 2272 saying, sorry if it's asked before, is erbium laser good for Asian skin? Yeah, it could be. It could be good for that because it doesn't have as much heat. So Asian patients could get more post-inflammatory hyperpigmentation. So yes, it could be a better option. What is the difference we have, doctor? What is the difference we have in Qatar between Accure and the AviClear? Please explain. So I have both. I have AviClear and Accure. AviClear and Accure are both the same wavelength, 1726. It's just targeting the oil glands and normalizing the oil glands. The difference is that AviClear is done based on power, and so some people can't tolerate like the amount of power that you have to deliver in order to get to the oil gland, and that could vary, and you don't really get enough feedback depending on like the patient. You may not know the fact that this particular patient had thicker skin and maybe they needed more power than you expected, and it's sort of a bit of a guessing game. And whereas Accure, what it does is actually based on temperature. So they found that the temperature that would really affect the oil gland, and they could target the temperature and be able to shrink the oil gland with that heat. What's nice is that they keep the skin on the surface cold because it just blows cold air, and then just targets just deep inside into the sebaceous gland. So there's a lot more feedback too. You see right there, right away, that it gets into that threshold for the patient for the temperature that's needed to normalize the oil gland. Useful. So I think that's the biggest difference. But maybe AviClear will change some things. I heard that they're planning on changing some things. Cool. Hopefully they do. It'll be cool. I don't know. At one point, some of these guys on Kitera were like bragging about their stock price, but the last time I saw their stock price, let's see, where is it at? It's like 36 cents or something like that. So I don't know. Hopefully they can make it through there. There's a lot of good guys there though too. Like I don't, there's people that are higher up that do things, but a lot of the people on like the street level, stuff like that, really nice guys, really good people too. Like I don't want them to lose their jobs because the corporation hasn't changed certain things. And hopefully they do, because they made a great device with XLV. I tell everybody, XLV, excellent device. So it's like, but other devices, it's like, I don't know. And hopefully they fix certain things and they continue to get better and better. What do you provide? Oh, hi Joey, how's it going? Good seeing you still on. Halo saying, how is it for acne scars? Pretty mild, honestly. Pretty mild for acne scars. A lot of our patients have tried Halo actually before. It didn't really seem to help. Boots is saying, do you provide pico laser on other parts of the body like knuckles? Yeah, we could do it anywhere, all over the body, no problem. I know I missed a few questions here, so I'm going to try to get to everybody that's like kind of been hanging out and answering the questions again. I'm actually going to try to circle back with you guys because I know you guys have been so patient, and I saw some people were asking again about Accure laser. So Accure basically normalizes oil glands. What it does is it targets the sebaceous gland, and it works very, very similar to the way Accutane works in terms of targeting actually the root cause of acne, that enlarged sebaceous gland. And that's why really at this point we can say it's just very similar to Accutane. And the best part is that you don't have to have any other side effects. You're just only localized to the face. So you don't have like the dryness that happens with your lips. I was in Accutane 3 times, so I had a lot of lip dryness. But with Accure, it's like you don't have any of those problems. You don't have like hair loss. You don't have like liver problems and things like that. Definitely do things for cystic acne. If that's like Accutane, isotretinoin, or if it's other treatments, whatever it is, do it. But Accure is at least another option for people. So the idea was just to have something for. I have some patients who just are on other medications, they can't even do anything because their liver just gets so damaged every time they go on Accutane. And they're like so frustrated. So Accure worked out so well for them. And a lot of people like that. What is the Halo laser? So good question. So Halo is a hybrid laser. Initially, I think they were touted as really the first hybrid laser, although now there's a few other options now. But it's a couple of different wavelengths. It's 1470 nanometers and 2940 nanometers. And as far as I remember, essentially there's like a rolling tool. I haven't used it in several years. I haven't tried it in several years. But basically, there's a rolling tip, and it will roll over the skin, sort of similar to the way if you've done Fraxel, it does that. And it kind of mixes this ablative and non-ablative form of the laser. So essentially, some form of it will sort of just like completely dehydrate the skin, and some parts will just work and just like kind of improving more like the collagen stimulation and trigger more of a collagen response. Problem that I have with it is that it's capped in the amount of energy you could give. So people like it in like more like the med spa world because you could outsource the laser and you could just kind of just have it so that there's a certain amount of heat or amount of energy that's going to be delivered there, and it's going to be relatively safe enough for most patients who are Fitzpatrick 1 through 3, so meaning lighter skin patients of European descent, but patients who are Hispanic, who are Asian, who are African. And, I've had some of them and they were told to do Halo. And so either, some of them, there was just way too low of energy, way too low of heat, which at least they did it safely. But some of them have been burned with it. Some of them have had post-inflammatory hyperpigmentation. Some of them have had new scarring due to that. Because, it was sort of touted by some people as like safe for all skin types because you could just go really low energy and it's like capped at like how much heat and energy is directed in with each roll and this and that. it's still risky. It's still going to have heat. So it's like they didn't pre-treat patient's skin still, and they didn't even get good results. So it's like really unfortunate that like a lot of these devices are pushed by places that shouldn't be doing certain energy devices, because sometimes if you're doing a device, that's sort of like that thing you do a ton of, and it's something that you're really comfortable with because you treat with all skin types, you treat with multiple different kind of conditions, and if you don't do that and you're pushing on somebody who you may not have been comfortable treating, if you don't treat African skin type and suddenly you're tightening an African skin type with a laser, that could be a disaster for that patient. And that happens, actually. It's really unfortunate. I am going to wrap up, though, in just a few moments, though. Yeah, I did go overboard, actually. Way overboard with timing. It was a really good interaction, though. I liked it a lot. So it looks like this new format, by the way, worked out pretty well for everybody with the new way it showcases with widescreen. So awesome. Really happy that happened there. I appreciate all of you guys, by the way. Thank you so much for all your comments. I will, you know what, I'm going to end tonight, though. I'm going to go hang out and just relax for a little bit now and maybe do a little bit of a workout. So appreciate you all, and I will see you, what day is today, actually? Today, Thursday? Oh, so I'll see you on Monday. I got mixed up what day it is there. So I'll see you Monday. Take care, everybody. Have a good night.